Good morning, everyone. Today, I'll talk about the responsibilities of care coordinator and the significance of nurses in coordinating and ensuring continuous care for patients. I'll discuss evidence based approaches to partnering with patients and their families to attain the best possible outcomes. Additionally, I'll examine elements of change management that influence patient experiences, particularly those valued by patients. I'll explore how care plans are constructed using ethical and decision making principles. Lastly, I'll explore the influence of policy provisions on patient outcomes and experiences. A care coordinator typically is a registered nurse specializing in developing care plans for patients dealing with chronic or complex healthcare conditions and provides continuity of care for the patient post discharge from the hospital. This professional closely collaborates with the patient's primary care physician, social workers, and nurses to identify individuals who could benefit from their services. They work together with community resources to create treatment plans, offer disease prevention strategies, and provide health education for self management and medication management. Studies indicate that care coordinators play a crucial role in reducing rehospitalization rates for patients with complex or chronic illnesses. Karam, 2021. Effective strategies to achieve desired health outcomes. When patients experience chronic conditions, it's crucial for healthcare providers to recognize the stress this causes and to convey empathy and support. As nurses, we are committed to respecting patients' needs, experiences, preferences, and values, known as patient centered care, an evidence based strategy that nurses should employ to improve patient outcomes is effective communication. Studies indicate effective communication involves both the patient and provider actively listening to each other without interruptions, ask follow up questions, express opinions, exchanging information, and fully understanding each other. Wham, 2021. It is crucial to recognize that effective communication with patients or family members is hindered when there's a language barrier. Nonverbal cues can be understood differently across cultures. To overcome language challenges and enhance patient safety and care quality, healthcare facilities provide interpreter services. Studies have demonstrated that using an interpreter improves patient satisfaction and communication among patients, families, and providers. Al Shamsi, 2020. According to Al Mesned, 2019, change management is defined as the ongoing process of revitalizing an organization's structure, direction, and capacities. It focused on improving performance to enhance satisfaction among patients and staff. Research indicates that strategies such as patient centered communication, social support, and staffing management have led to increase in patient centered care. Implementing these strategies has resulted in more positive patient experiences, the interactions in the hospitals, and overall improvement in patient satisfaction, subjective thoughts of the patient during their stay. Abeka, 2021. Research indicates that patient centered care, which emphasizes respecting and meeting patients' needs, enhances their satisfaction and overall experience. Nurses play an important role in this process by offering effective communication, a positive demeanor, encouragement, and a sense of compassion, all of which contribute to improving the patient's experience. Quam, 2021. Patient satisfaction often depends on the quality of their experience, typically assessed through post discharge surveys. Rationale for coordinated care plans. Care plans are customized to meet the individual needs of each patient. Coordinated care plans involve an interdisciplinary team that includes the patient. Patients are actively engaged in making decisions about their care, which fosters a sense of autonomy and ensures they are informed about any changes to the care plan. Karam, 2021. I believe that involving patients in coordinating their care encourages them to adhere to the plan. Ethically, I believe this approach is the best for patients as it prioritizes their well being and ensures the best possible outcome. As per the American Nurses Association, the four primary bioethical principles encompass non malfeasance, justice, beneficence, and autonomy. Rayner, 2018. These principles are integral to nursing practice at all levels and serve as guiding factors in daily care decisions. Nurses pledge to uphold these principles, ensuring patient well being by avoiding harm, now non malfeasance, respecting patient autonomy in decision making, acting in the patient's best interest, beneficency, and maintaining fairness and honesty, justice. Incorporating these ethical standards into patient care promotes a higher quality of care and enhances the overall patient experience. Healthcare policy provisions. When nurses assist patients in determining the best intervention for optimal outcomes, it is crucial to consider their insurance state, as they may be eligible for coverage under the Affordable Care Act, also known as ACA. Enacted in 2010, the ACA is regarded as the most significant healthcare reform since the establishment of Medicare and Medicaid. Its provisions include the elimination of lifetime or annual coverage limits, ensuring access to health coverage, prohibiting discrimination against individuals and pre existing conditions, and offering prevention care. Additionally, the ACA provides funding for community health centers and aims to improve healthcare availability. Campbell, 2020. In conclusion, I discussed the role of a care coordinator and the impact nurses have on patient outcomes and quality of life. I outlined effective evidence based strategies for collaboration with patients and families, emphasizing the importance of patient centered care in improving their experience and satisfaction. Additionally, I discussed the significance of ethical considerations in care planning and how adherence to the Code of Ethics enhance care plan outcomes. Lastly, I identify key healthcare policy provisions that influence patient outcomes. I trust that you have found this presentation informative and enjoyable. Thank you and have a great day.